Please start now, doctor. Doctor, you can start. You are live now.
All right. Can I start now?
Yes, doctor, you can start now. You are live.
Okay. Hello, everyone. My name is Dr. Gaurav Sahai. I'm a senior consultant nephrologist at Fortis Hospital, Shalimar Bagh. I've been in the practice of nephrology for almost last 15 years. And prior to that, I'm also trained in internal medicine. So I look after patients of internal medicine as well as nephrology. But today, the focus of our talk is going to be about kidneys. What are they? What do they do in our bodies? How do they function? How essential are they are to us? What are the signs and symptoms of kidney disease, and what can be done to avoid kidney disease, and what are the treatment options available? So let's start about what and where our kidneys are. The kidneys are a pair of bean-shaped organs which are situated on either side of the backbone on the back wall of the body cavity. So roughly around the level of your lower waist. So a lot of people think that kidneys are somewhere near our tummy, but that's not the truth. The kidneys are more towards the back, towards the spine, and towards the flanks. So that is why a stomach pain is can usually not a kidney pain. A kidney pain usually manifests as low back pain or flank pain, and not as a stomach pain. So the pain depends on the anatomical location of our kidneys. The size of our kidney is roughly around 9 to 12 centimeters. They are very small in size. Both kidneys are roughly of the same size, but there can be some anatomical variations between the sizes of the two kidneys. There can be a difference of around 1.5 centimeters in the sizes of both the kidneys. Whenever we do an ultrasound, which is a very basic investigation for the kidneys, we always read the kidney size. That is always mentioned in the ultrasound report. So the ultrasound report will mention your kidney size in centimeters. So we must, it is important for us to know that the normal size of the kidney is around 9 to 12 centimeters with a variation of 1 to 1.5 centimeter. And any kidney which is smaller than 8 centimeter in size is called a small kidney. So what are the functions of the kidney and why are the kidneys so important for us? Now, one function that we all know that the kidneys do is that they keep us healthy by getting rid of the waste products from the bloodstream, and all that waste products is taken out from the body by way of urine formation. So this is something we know about, that we all know that it's responsible in layman language for purification of the blood. But apart from that, there are also many important functions of the kidneys which a lot of people don't know. And the most important of one of them is, of course, waste products, and the other one is fluid control. Most of the water metabolism, that is control of how much water remains in the body and how much goes outside the body, is controlled by the kidney. As all of us know that there are only two ways we can get rid of water from the body, or there are only two ways of water to exit from our body. One is through sweating and one is through urine formation. There is no other third way, at least in a healthy person. So fluid control is a very important function of our kidneys. The kidneys regulate how much water has to be retained in the body and how much has to be taken out of the body depending on the circumstances. For example, a healthy person would pass a very little amount of urine in a hot and humid weather, but the same person would start passing large amounts of urine in a winter weather when when there is um, less requirement of water, even if they have the same amount of water intake. So all this is controlled by the kidneys. Other thing which a lot of people also don't know, most people think that blood pressure is a measure or a function of heart activity. It's not so. The main organ controlling our blood pressure is the kidneys. The trigger to increase the BP lies within the kidneys. Indirectly, through sodium metabolism and controlling this amount of sodium in the bodies, the kidneys control the blood pressure. Therefore, one of the earliest signs of kidney disease is high blood pressure. That does not mean that everybody who has high blood pressure is suffering from kidney disease, but it might be possible that it could be a early symptom of kidney disease, which could be easily be overlooked or passed off as just a case of normal, harmless high blood pressure. So we have to make a difference between the two. What is hypertension and what is hypertension related to kidney disease? So we've already discussed three functions of the kidney. One is purification of blood. Second, controlling the sodium and the water status of the body. And third, control of blood pressure. Another thing that a lot of people also don't know, that we all know that red blood cells and blood is manufactured in the bone marrow, that is in the bone marrow of the, which lies inside the long bones. But for the bone marrow to function properly, the kidney makes a hormone which is called erythropoietin. Erythropoietin is the hormone which is secreted from the kidneys, and through blood it reaches the bone marrow, and it kickstarts the red blood cell production in the red blood cell factory which lies in the bone marrow. And therefore, when the kidneys are affected, most patients will start developing anemia even if they are eating well and even if there is no obvious blood loss. But since that hormone is missing, the blood factories in the bone marrow cease to function and the patient becomes anemic. A very important function of the kidneys is to keep bones healthy. Now we all know about what is responsible for bone health. We know about calcium, we know about vitamin D, and we know about how bones become weak as we age. But what we don't know is how is all this related to the kidneys. Whatever calcium is taken through diet or through tablet has to be absorbed from the gut or the stomach, and for that we require vitamin D. Without vitamin D, neither can calcium be taken up by the gut and the stomach, and neither can calcium be incorporated into the bone. For that, we require vitamin D. And vitamin D is synthesized by our skin when we get exposure to sunlight. We all know that we are asked to stay in the sun because our skin synthesizes vitamin D. But that vitamin D is synthesized in an inactive form. For it to become active, to start doing its job, it has to be activated inside the kidneys by some complex chemical reactions. And once it is activated in the kidneys, only then it can act on rest of the bodies. Therefore, when we have a kidney disease, in spite of the fact that our dietary intake of calcium is good, we are also taking vitamin D supplements, but still the bones will start becoming weak because the activation of vitamin D to an active form does not take place in the kidneys because of disease. The other important job of the kidney is to maintain the acid base status of the body. Now, if all of us have studied chemistry, and we know that there is something called a pH of the blood. Just like any other pH, the pH of our blood is kept within certain limits, and it is strictly regulated because the blood should not be allowed to become too alkaline or to become too acidic. This control is taken care by the kidney. If there is too much acid generation in the body, the kidney acts by secreting the acid through the urine. So I was talking about, so let's sum up the functions of the kidney that I've just spoken about. So the functions are that it removes waste, it is responsible for sodium and water removal, it is responsible for hormone production, it is responsible for calcium and vitamin D metabolism. And if a problem arises in any of these functions, then patient will develop symptoms of kidney disease. What could be these symptoms? For example, If the patient develops sodium or water excess, then the patient will start developing swelling. If there is a decrease in waste removal from the kidney, then the patient will start developing increase in urea, creatinine, and other electrolytes such as potassium. If there is a decreased hormone production, patients will have anemia. And if there is lack of vitamin D, the patient will develop weak bones. And also, like I specified before, if there is even a mild variation in the pH status of the blood, that can lead to the blood becoming more acidic, and that has a very bad effect on other organs of the body apart from the kidney. So let us talk what are the common kidney disease that we encounter in our clinical practice. Now, if you ask me, the number one disease that I come across in my clinical practice, which is affecting the kidneys, is diabetes. Diabetes, as you know, in our country has acquired epidemic proportions, and sorry, there are a lot of diabetic patients, and it does not mean that all diabetic patients will end up with kidney problems, but long-standing diabetes, uncontrolled diabetes can inevitably lead to kidney problems. And most of the patients of kidney failure that we see in our clinics and our hospital are long diabetics. The other illness which is closely associated with renal problems is high blood pressure. From high blood pressure, I don't mean that every blood patient with blood pressure will develop kidney problems. As a matter of fact, most patients with high blood pressure will not develop any kidney problem, even if they have blood pressure since many decades. But it is patients who have uncontrolled blood pressure or undiagnosed high blood pressure. These are the patients who will develop kidney problems, because unlike diabetes, which is a symptomatic illness, diabetes patients will have some symptoms of diabetes. Patients of high blood pressure often have no symptoms. They go about their daily activities without any symptoms, without any problems, without realizing that their blood pressures are high. So these are the patients who, after 10 years or 20 years of hypertension, can develop hypertension. Always also remember that diabetes and blood pressure will never lead to kidney problems within a year or two or a few months of the onset. These are chronic illnesses. And chronic illnesses take a lot of time to affect any part of the body. And the same is true for diabetes and blood pressure. Then let's talk about renal stones. Renal stones can lead to kidney disease. How? Per se, renal stones usually present with kidney pain. They don't usually present with kidney failure or kidney disease. They present with pain. They're a very painful condition. However, if the renal stones are overlooked and they are causing an obstruction to the urine flow for a long time, for example, a situation when you have a kidney stone, you go to the doctor, and once the pain subsides, you forget all about it and go about your life as usual without getting any treatment. Such a situation can lead to kidney problem, because although the stone does not cause any symptoms, but while it remains in the kidney, it can damage your kidneys in the long run. Now, apart from this, the other causes are a group of diseases which are called glomerulonephritis. Glomerulonephritis is a group of diseases which implies inflammation of the kidneys. Now, these are a group of diseases that can occur to anyone, even to a child 2-year old or a 90-year-old. There is no age bracket for these diseases. And for most of these illnesses, which are called glomerulonephritis, the cause is not known. They are diagnosed on the basis of test, but we still don't know what causes those diseases. Fortunately, they are not as common as diabetes and blood pressure. So we don't see as many patients of these diseases as we see of diabetes and blood pressure. Now, something that we see more commonly is kidney disease arising because of misuse of over-the-counter painkillers. Now, in our country, unlike many Western countries, we do not need a prescription to buy painkillers. You can just walk into a chemist, ask him for a box full of painkillers, and he'll happily give it to you. without asking any questions why you are taking them or whether you should take them or not. So but then we have this culture, many patients we come across who are, just for the sake of feeling good, popping painkiller every day just to be pain free. So this kind of abuse of painkiller, I am specifically using the word abuse. Abuse is when you take something which is not required and not prescribed, and using beyond what is the requirement, what is the dose requirement. So I use the word painkiller abuse. So for patients who are abusing painkillers, years of painkiller intake can lead to kidney failure. And I'm talking of very common painkillers which are available in the market. For example, Brufen, Voveran, Combiflam. These are all combination pain drugs which are easily available in the market. You are taking one or two tablets over a couple of days, obviously is not going to harm your kidneys. But if you keep on taking them for months and years, then they can lead to kidney problems. So what happens when the kidneys start failing? What do I mean by when the kidneys start failing? I mean that the kidneys don't work optimally. They are not able to work as they should be in a healthy person. And it's not that they will stop functioning overnight. Sometimes this process of failing kidneys can take months, but sometimes it can take days. And therefore, we divide kidney failure into two types. One is acute, which is usually reversible, and the other one is chronic, which is irreversible. So, acute kidney failure occurs when the kidney failure is taking place over a matter of hours to days. And the best example for this would be a bout of severe gastroenteritis or diarrhea leading to severe dehydration and the kidneys shutting down because of severe dehydration. This is a common scenario we see. And fortunately, when we give the patient lots of fluids, ORS by mouth and intravenous fluids, the kidneys start functioning again and they are back to their normal function within let's say 7 or 2 weeks. This is called acute kidney failure. In contrast to that, chronic kidney failure is something that develops over weeks to months. This is the kind of, or years. This is the kind of kidney failure that develops in diabetics, hypertensive, in other patients of other chronic illnesses. So this is a kind of failure which is gradually progressive, and most of that is why it is not very symptomatic. Your blood test would start worsening over a matter of months, sometimes years, and it's not noticeable to the patient. Till the time the symptoms start appearing, there might be a gap of months or years before the onset of illness and the onset of symptoms. This kind of chronic renal failure is usually irreversible. So, who are the people who are developing kidney disease? Now, it's not feasible and it is not practical also to screen or test the entire population of the country for kidney disease. It's not possible that I write that everybody in the country should have a kidney function test done. That's not possible. And it's not required also. Now, but there is a certain subset of patients who should be more careful. Now, these are patients who have diabetes or a family history of diabetes, patients who have high blood pressure, patients who have genetic kidney diseases. One of them is called polycystic kidney disease. That is one of the most common genetic diseases. When what are cysts? Cysts are balls filled with blood, with the water. They start forming automatically without any apparent reason inside the kidneys due to a genetic illness. Then there are patients who are taking prescribed or non-prescribed painkillers. We have a lot of patients who have been prescribed painkillers for knee pain, but and they keep on taking and to get themselves free of pain. And then there are patients who have not been prescribed but who take it just for relief. So these are also patients who should be screened for kidney disease. Then you talk about infections. I didn't speak about the infection is that a urinary tract infection that gets complicated by affecting the kidneys. Urinary tract infections are especially very common in women and they should be promptly treated. And in some persons, I'm also coming across a lot of young people taking very all sorts of fancy diet supplements who work out in the gym. So for most of the part, I don't know, and the person taking the supplement also doesn't know what is inside that box, because we really don't know what is inside that the box. But they're all passed off as protein supplements. But I personally think there is much more in them apart from protein. For some reasons, they cause what weight loss and they build muscle mass, and we really don't know what goes inside their boxes. And so I come across a lot of patients who come with kidney problems after taking protein supplements or other bodybuilding supplements over a long time. So that is one new group of patients that we are seeing nowadays. So now let's see. Now that we have discussed the causes, the symptoms, wait, we have not discussed the symptoms. So let's talk about a little bit about symptoms. Now, what one thing you must remember that these symptoms of kidney disease are very, very subtle. Subtle, what do I mean by subtle? That they can be easily overlooked. There is no hard and fast symptom which really can pinpoint to kidney disease. Most of the patient describe very vague symptoms such as fatigue, thakan, and decreased appetite. Sometimes they notice swelling of the legs towards the evening. Some patient complain of early morning nausea, and some patient complain of passing urine frequently in the night. But these are symptoms that can be easily overlooked by the patient and by the doctor, because we must remember that the real bad symptoms of kidney disease only appear once the kidneys are damaged more than 75%. So even if your kidneys are working only 25%, there is a chance that you may not have any symptom of kidney disease. And once you reach advanced kidney failure, only then you start developing symptoms of kidney disease. And these are fatigue, swelling all over the body, vomiting, decreased amount of urine, breathlessness, nausea, weight loss, foul odor coming from the skin, intense itching. Itching can also be a part of kidney disease, a part of kidney disease, symptom of kidney disease. So these are the symptoms that you see in kidney disease. And in advanced kidney failure, the patient can become unconscious. He can go into coma. The urine can completely stop coming if the kidneys have completely failed, and the patient can become unconscious also. Sometimes he may have fits. From fits, I mean seizures, because the urea becomes so high that it starts affecting the brain, and the patient can have start having fits and seizures. What are the tests? Now let's come to what are the tests that we do to diagnose kidney disease. And the special thing about tests for the kidneys are that if you compare it to tests for other diseases like diseases of the brain or diseases of the heart or any other thing, the tests for kidney disease are very basic and very inexpensive. There are such basic and inexpensive tests available that you really don't have to spend much money to get yourself tested for kidney disease. The only thing you need, one is a urine test, a plain urine test, an ultrasound of the kidney, and a kidney function test. These three tests will tell you everything about kidney disease, and you can be pretty sure if your urine test and kidney ultrasound and kidney function test are normal, then you can be almost 100% sure that there is nothing wrong with your kidneys. So what do we see in the urine test? Now what we see in the urine test, we can see for infection, then we can see for protein. A normal urine test will never show any protein in the urine. Any protein appearing in the urine is always abnormal. It should never be present. And also, red blood cells appearing in the urine. There are never any red blood cells in the urine. If ever we find that the urine is showing RBCs, it means that there is something wrong with the kidneys, and we have to find out from where these RBCs are coming. Next is an ultrasound. Like I said, an ultrasound can give a very rich information about the kidney. It can tell us about the kidney size. It can tell us about kidney stones. It can tell us about kidney infection. It can tell us about any cyst in the kidney. It can also tell us about the prostate, that is a part of the ultrasound KUB. We call it ultrasound KUB. It can tell us about disease of the bladder. So it's a very basic investigation, but it gives a lot of information. And the third thing that we do is a kidney function test. A kidney function test would usually include a urea, a serum creatinine, serum sodium, potassium, and serum calcium. So, so these are the basic tests, or these are the tests we do. Apart from that, there are other tests which we do. We can do nuclear scans. Sometimes when we want to see the functioning of the kidney, we do nuclear scans. I won't go into the detail, but I'll just tell you the names. There's something called a DTPA scan, and there's something called a DMSA scans. So these are basically nuclear scans we do for additional information. In some circumstances, we also do MRIs of the kidneys when we have to look for cyst. And many a times we have to do invasive tests. What are invasive tests? Invasive tests is when we poke a needle into the body. This is called an invasive test. And the invasive test that we do for the kidney is called a kidney biopsy. That is in ultrasound guidance. We put in a needle inside the patient's kidneys and take a very small microscopic piece from the kidneys and analyze it under the microscope to find out what is wrong with the kidneys. Okay, so now we've talked about the symptoms, how to make a diagnosis, and what. Now let's talk about what can a healthy person do. For example, if there's a XYZ person who has no diabetes, no hypertension, and he wants to know what can we do to make keep our kidneys healthy. So one thing I want to tell you that there are a lot of diet fads. Eat this, that will keep you healthy. There are no fad diets for the kidneys. That eating this particular thing will make your kidney healthier. There is nothing like that. There are certain things which can damage your kidney, but there is nothing which can make a normally healthy kidney even more healthier. So we have to be very clear about that. And what we have to do is we have to make sure that if we have diabetes, it's under control. It's not missed. If you're hypertension, get your hypertension regularly checked. If you're obese, you should try to lose weight. Try avoiding painkillers as much as you can. Don't eat any supplement or dietary supplement of any kind for any purpose unless and until you are very sure what is the content of that box, even if you're eating it for weight loss. And have an adequate intake of water. An adequate intake of water is whenever you feel thirsty, you should drink water. Now, but it doesn't mean that you have to push yourself to drink lots and lots and loads of water, like 3, 4, 5 liters per day, thinking that this is going to help my kidney. No, it doesn't help your kidneys. Excess water will not help your kidneys. It might, in long run, it might be, as a matter of fact, might harm the kidney. So, depending on your thirst, you should not try to uh, pass it off if you're busy. If you're thirsty, go and drink water and make sure you have an adequate intake of water as per your physical activity and as per the environment. If you're sitting in an air conditioned room, your water requirement would be less. And if you're working, or if you're a laborer working on the street at 40 degrees centigrades, obviously your water requirement would be different. So both of them cannot have the same water intake. It's going to be different for all of them. Now, what else can we do? Now, other thing is, which I've also mentioned before, that if there is a kidney stone and it is not causing any pain, even if it's not causing any pain, it has to be treated. Don't ignore kidney stones. And what can we do to treat the kidneys? Once the patient comes to us with kidney problems, we do all the battery of tests to find out what is the stage of kidney disease. We quantify kidney disease from stages 1 to 5, and we accordingly we decide the patient's treatment according to the stage of chronic kidney disease. We advise the patient about how much water he or she can take. We correct the blood pressure. If the patient is we modify if the patient is diabetic, we modify the treatment as per kidney disease. We ask the patient to have a protein restricted diet. Protein restriction diet is recommended for kidney disease. Just like in a diabetic patient, we ask the patient to avoid sweets or sugar. In kidney patients, we ask the patients to have a diet which is not very high in protein. We also ask the patient to have a potassium restricted diet. If the patient is having kidney disease, that is, he or she is asked to avoid diet that is rich in potassium, such as juices, soups, coconut water, and things like that. We correct the patients by giving iron supplements and by giving hormones injections to correct the anemia. We give the patient calcium supplements and vitamin D for bone health. If, however, in the unfortunate circumstance, the patient's kidney fail, and the patient, then I as a nephrologist have to take a decision whether this patient needs to be started on dialysis or not. Now, there is a general image in the general public that dialysis is the end of everything, and it's a very painful procedure. And once dialysis has been started, things are anyway going to end. Now, I think that's a myth. Uh, we have patients in our hospitals who are undergoing dialysis for last 10 years or maybe more. So dialysis is the replacement of kidney function. That you must understand. We don't treat the kidney disease by dialysis. We replace the kidney function by doing dialysis. And dialysis usually has to be done 2 to 3 times a week, and it's done in a hospital setting or in a clinic, in a small nursing home setting. And the patient can usually comes walking to the dialysis unit, stays in the dialysis unit for 4 hours, and then can go home. There are no preparations required, and there are no blood transfusion or anything else required for dialysis. You just need a patient and a dialysis machine. There's also something called a peritoneal dialysis, which is also called in the layman language as stomach dialysis. This is a dialysis which can be done at home by the patient. In this, through a surgical procedure, we insert a tube inside the patient's stomach, and that stays inside the patient's stomach, and the patient connects that tube to a water bag which is around 2 liters, and after filling up his tummy with 2 liters of water, that water stays in the tummy for 4 hours, and then he takes out that water. And while that water comes out of the stomach, it collects all the impurities from the blood, not from the stomach, from the blood, like urea and creatinine and other things, and that is taken out by the that fluid. This is called a peritoneal dialysis, and this fluid is called a peritoneal dialysis fluid. This is done in the home setting, and the best and the treatment that is available for kidney failure patient is kidney transplant, which is a surgical procedure. Patient with kidney failure is transplanted with a kidney which is donated by another person, another healthy person. That kidney is transplanted in the right side of the lower abdomen, and the patient retains his 2 previous kidneys. So the patient will have 3 kidneys after a transplant, 2 poor non-functioning and 1 new kidney donated by the donor. After kidney transplant, patient has to take some medicines lifelong, which are called immunosuppressants. These are given to patients after transplant, and patient has to take them lifelong. But after kidney transplant, the patient can have a very healthy life and need not undergo dialysis again in the future, as long as the transplanted kidney is functioning. So that's about all. That's about all. Thank you. Hello. Hello.